Today's episode is brought to you by the DAX Copilot from Microsoft. DAX Copilot is your AI assistant for automating clinical documentation and workflows, helping you be more efficient and reduce the administrative burden that causes us all to feel overwhelmed. To learn more about how DAX Copilot can help you reduce burnout and restore the joy of practicing medicine, stick around after the episode or visit aka.ms/knock-knock-high. That's aka.ms/knock-knock-high. Knock, knock, hi. Hello, everybody. Welcome to Knock Knock I with me, your host, Dr. Glaucom Flecken. Thank you for joining me at the end of a long day or in the morning. Do you like to listen to me as you get ready for work? I don't know what you're doing, but hopefully it puts you at ease and helps you just feel good, at least about your knowledge of eyeballs. That's the goal here. This is your one-stop shop for eyeball stuff. I was in clinic all day. Had a great day. Event went very smoothly, and nothing too out of the ordinary or exciting showed up, which I think is a good thing. You know, sometimes it's okay to have something new that you have to do research and try to figure out what to do, what plan, what medications, what orders, what lab results you need, what imaging you need. Those types of patients that come in and you kind of throw a little bit of a wrinkle into your day. Today wasn't one of those days for me. Today was just run-of-the-mill, did a lot of diabetic exams, some post-ops, some pre-ops, some chalazion, no procedures. So just kind of an ordinary day. All right, nothing really exciting. But it was okay because I like clinic. And that's what I find, one thing I find so interesting about the field of medicine. There's something for everybody. You can tell by all the different personalities in my skits, right? There's so many different types of doctors that like different things. One physician, you'd ask how they feel about clinic, and they would rather die than spend a single second in a clinic seeing patients. I feel that way about hospital medicine. Like that's the last thing I'd ever want to do. And so it's fascinating, and there's something for everybody. But anyway, it was a good day. And now I get to share some eyeball knowledge with you guys. I've got some fun stuff today. We are going to start with an update on something I talked about. I believe it was last episode. There was, you know how excited I get when there's eyeball stuff in the news. When anybody and everybody talks about eyeballs, it hits the pop culture medium, and it just, it's like what is it? A fly to honey? I don't know what the saying. I'm probably getting that wrong. Is that right? Fly to something to oil? No, it's honey. Bees to honey? No, bees make honey. Anyway, doesn't matter. Someone tell me what it is, because it's going to drive me crazy for a bit. Anyway, Kyle Van Noy, a linebacker for the Ravens, as I mentioned. If you remember last week, I talked about how he had an eye injury. He had an orbital fracture. We talked about orbital fractures, so go back and listen to it. He had an orbital fracture and was upset because the Chiefs, the training staff, did not get to him in what he thought was a reasonable time frame. And by staff, he was referring to the ophthalmologist. All right, so there's an update. New information came out. All right, so this is from a reporter who said, Chiefs Rick Burkholder speaking on the Kyle Van Noy comments. So some Chiefs official says he's been in contact with John Harbaugh, the Ravens coach, and other members of the Ravens organization to clear the air. He says that the Ravens initially declined an ophthalmologist. All right, so their staff, they evaluated this player, saw that he had an injury, but declined to see an ophthalmologist right off the bat. But when one was eventually requested, the ophthalmologist arrived in 12 minutes. 12 minutes. That's 2 cataract surgeries, by the way. And I said on Twitter, I was like, give this person a Nobel Prize. That's unbelievable response time. That is, you got to publish that. That's unheard of. And that's the reaction you get that I got when I talked about this and I amplified this on social media. 12 minutes? Damn. It's making the rest of us look bad is what it's doing. All right. I don't know who this ophthalmologist is. Like, more power to this person for responding that quickly, whoever it is. But man, really setting the bar a little bit high for the rest of us. I'm not sure how I feel about that. All right, we've done a good job of setting expectations a bit on the lower side, but now I feel like all that progress really has gone out the window. So hopefully, I'm happy to talk about this because it's an interesting topic to me, at least. But hope it doesn't get too far. Don't spread this. Yeah, I love what you share my podcast episodes and whatever, anything on social media. This little tidbit here, maybe keep it on the down low, because I don't want word getting out that we can see patients in an on-call environment situation in 12 minutes. God, it's impressive. It really is. So anyway, I'll close the loop on that one. I was, it didn't pass the smell test to me. I knew there's something up because, I don't need to rehash it all, but, that response time, wow, incredible. Okay. So, let's get to some questions. I think last week I didn't do any YouTube questions. So these are all comments / questions / thoughts that were presented on my YouTube channel that I share with Lady Glockenflecken. It's called The Glockenflecken. No, actually, it's just called @Glockenfleckens on YouTube. That's where all the podcast episodes are going. And I monitor that and like to address certain any good comment, any interesting comment. I'll bring it up on these podcast episodes. And I'm getting more comments. So I think me like trying to push this is probably helping a little bit. People are going there. They're responding. They're telling me what they think of the episodes. Love the feedback. All right. So go check it out @Glockenfleckens. The most recent episode that was published as of this recording date I talked about never events. It was about the surgeon in Florida who accidentally took out a spleen. This is obviously huge news and was a big talking point on social media among the healthcare professionals. We still don't know all the details of this. We know like the path report. We don't, but as far as like what kind of litigation there will be, that remains to be seen. So I'm not going to oppose any other thoughts on that. It'll take care of itself. There will be depositions. There will be people on the record talking about this. But so we'll see. We'll see what happens there. Horrifying, terrible situation for everybody involved. Everybody involved. But obviously, particularly the patient and their family who died. And so it's but it's what we call a never event. It's a complication that, well, I would say in my mind, it's a never event. A never event would be operating on the wrong part of the body, right? That's what you would consider something. We have safeguards in place to prevent that from happening. So but this sparked a lot of interest and a lot of comments on my YouTube channel. So there were a few comments. @TankGuy3 said, is a never event a no pants patient for a malpractice lawyer? Got a good chuckle from me when I read that. Good question. So you guys know what we have pants patients and we have no pants patients in ophthalmology. So that's how I started these Knock Knock Eye episodes, was talking about pants patients. The pants patients, like bad ophthalmology stuff that makes me come into the hospital immediately without even putting my pants on. All right. Open globe injuries, chemical burns, extraocular muscle entrapment, endophthalmitis, an infection inside the eye. That is the only no pants patient in ophthalmology. That is such an emergency. I'm not even putting my pants on. I'm coming in. I'm just Winnie the Poohing right into the emergency department, and everyone's just going to have to deal with it. I'll accept the legal repercussions later, but I'm seeing that patient without pants on. So, but to his question, is a never event a no pants patient for a malpractice lawyer? I don't think they move that quickly, but they probably, those malpractice attorneys probably chomping at the bit for stuff like operating on the wrong body part. Yes, certainly. Another surgery-related question, and then we'll take a quick break. At Travels and Books said, can you tell me more about the surgery timeout? Because I talked about how we have timeouts in the operating room to help prevent never events from happening. Operating on the wrong patient, the wrong body part, doing the wrong surgery, all those things. In ophthalmology, putting the wrong lens inside the eye. That's something you should never do. And the timeout is crucial to that happening. And so the timeout is the whole surgical team, once we get in the room with the patient, before anything is done. Oftentimes the patient's already prepped and draped. Sometimes the timeout's done before that. Kind of depends on the operating room and the people involved. But certainly before you ever do anything to the patient, everybody is quiet. Anesthesiologist, surgeon, all the nursing staff, obviously the patient who may or may not be awake, but they're quiet as well. Everyone's really quiet. And it's the surgeon, and this is what I think, and I've actually had some pushback on this because there are lots of places where like the circulator nurse or the charge nurse runs the timeout. I personally think the surgeon, who's the one in charge of the surgery, should always be doing the timeout. That's how I run my operating room. That was a test question on my oral boards. Who runs the timeout? And I got it right. The surgeon runs the timeout. That's what I think. I know other people do it, and other ways are not wrong. I think that's the safest thing to do, is have the surgeon run the timeout, because they're the ones ultimately that are making the incision on that patient. So anyway, whoever's running the timeout in my operating room, it's me. I'm the surgeon. I'll say the patient's name, with the surgery we're doing, the eye we're working on, the lens, the artificial lens that's being put in the eye. But so you basically just tell everybody what is going to happen. And then everybody's listening. And if anybody hears wrong information, like the wrong patient, the wrong date of birth, the wrong eye, the wrong location, the wrong lens, then it's on everybody in that operating room to listen and to speak up if they hear a mistake. Or if they just didn't hear it. Like, can you say that again? Or can you clarify? Or get any questions whatsoever? Everybody needs to know exactly what is about to happen in the operating room. Everybody needs to be on the exact same page to prevent a mistake from happening that we would consider a never event. A mistake that is easily prevented just by making sure there's no massive mistakes like that. So that is the purpose of the timeout. And depending on the surgery, how complex it is, there might be more to that timeout, like blood typing, whether like certain devices or certain, transfusion materials you have in the room. It's going to be more complex. It might take a little bit longer. For me, the timeouts are really quick. They take like 10 seconds because it's a fairly simple surgery, cataract surgery, but it can be longer for other surgeries. So anyway, that's the timeout. Good question. Let's take a break. Okay, here's another question I have from the @Glockenfleckens YouTube comment section. This is from @OldDion9863, who said, people memorizing the eye chart. I talked about patients memorizing the eye chart and like actually telling me that they memorized it. If you're going to memorize it for like nefarious purposes, maybe don't tell your eye doctor you're doing it. Don't advocate for that. Please don't do this. People memorizing the eye chart for their driver's license is terrifying. I really wish we were less car dependent in America so that we could be a lot stricter with driver's license. I'm so sorry, Grandma, Grandpa, but you driving is really not safe for anyone. LOL. So this brings up a very interesting point, and it is just the legality of driving with impaired vision. Impaired vision can mean a lot of different things. I've talked a lot about the definition of blindness, and how vision is a spectrum. You can have 20/20 vision, you can have 2100 vision, you can have count fingers vision, you can have hand motion vision, you can have light perception or no light perception vision. And all those different levels of vision allow you or don't allow you to do certain things in life. And so driving is no different. There's a certain level of vision you need to drive safely. And that's what state by state in the US, every state, fortunately, thank God for this, every state at least has some level of driving a vision requirement to qualify for a license. That's the good news. The bad news is it varies dramatically. And I have some might be terrifying information depending on where you live. But what I did was I went through, after reading that comment, I think I may have talked about this a little bit before, but I went through and found what I think are the 5 states that are that have the most lax vision requirement for a driver's license. The scariest places to live when it comes to people driving with impaired vision. That's what this segment is, okay? So here we go. Let's do this. All right, number 5, and I tried to order these like 5 to 1 being the worst, okay? So 5 is Maine, the great state of Maine. So let me pull this up. Maine, let me tell you what those requirements are for Maine. So you have to have 2100 vision in both eyes. Both eyes have to have 2100 vision. So remember, 20/20, that's our standard for like quote unquote perfect vision, okay? 2100 means that what you can see from 100 feet away, someone with 2100 vision has to be 20 feet away to see that. All right. It's kind of complicated, but let me explain that one more time. So if you have 2100 vision, that means that at 20 feet, and we just use 20 feet as just a standard. This is a standard. People in other countries use a different system. They use meters, obviously. But so if you have 2100 vision, that means that, again, at 20 feet, what you can see, someone else with normal vision can see that same thing 100 feet away. So you have to be that much closer. You have things that much larger in order to be able to see. So it's pretty dramatic vision loss, okay? Anyway, so Maine, 2100 in both eyes. Both eyes have to see at least 2100 and a visual field requirement, 110 degrees. So this one, Maine gets knocked down because 2100 is not great vision. It's pretty bad vision. I would not feel comfortable with a patient driving with 2100 vision. And just to give you a frame of reference, the vast majority of the states, I would say 75% of the states, have about 2040 or 2050 as like your worst seeing eye has to be at least 2040 or 2050 for an unrestricted license. That's what we're talking about. Unrestricted. You can drive without glasses or not even glasses, but under any circumstances at night. You can drive all hours. It doesn't matter. There are certain restrictions you can put on someone's license, like in order to reach that threshold, if they have to wear glasses, well, then they'll have a restriction. Like this patient with their glasses qualifies. It'll say that on your license, so that if a cop pulls you over and you're not wearing your glasses, but it says on your license or in your record that you have to drive with glasses, then you'll get in trouble. All right, so Maine, they're not great for Maine. But the good news is they do have a visual field requirement, which I think is also very important. And theirs is 110 degrees. I wouldn't worry too much about that's a good amount of visual field. Okay, so they have the acuity and the visual field requirement. Number 4 on my bad list. Let's just call this my bad list. Bad driving list. Oklahoma. That's right, Oklahoma. They have to have 2100 in their better seeing eye. So that means only one eye has to see at least 2100 to qualify for an unrestricted license. They also have a visual field requirement of 70 degrees, which is less than Maine. Maine was 110 degrees, 70 degrees, pretty good. All right. Adequate, I would say, but the 2100, still not great. Louisiana, number 3. That's my number 3 state. Louisiana is, they are, I'm pulling it up here. And you can find all these. This is all public, obviously. So this is the only state I have in my list where the vision the requirement is actually better than 2100. It's 2070. You have to have 2070 vision. Not bad, but the reason they get knocked down is because they have no visual field requirement. There's a number of states that have no visual field requirement whatsoever. Alaska, Colorado, Delaware, Idaho, Indiana, Louisiana, Montana, Nevada, New Hampshire, New Jersey, South Dakota, Tennessee, Texas, West Virginia. All of those states have no visual field requirements. This is very dangerous. So think about this. There's a lot of diseases, and we talked about one recently, or have in the past, with certain types of retinitis pigmentosa, certain types of, or severe glaucoma is a much more common one, where you can have severe loss of peripheral vision, but you might still have a central little island of vision where I have patients that can read the chart 20/20 perfect, but they have no peripheral vision whatsoever. You got to be right in front of that person for them to be able to see you. No peripheral vision. In these states that have a visual field requirement, they wouldn't pass. And you can understand why you need that, right? We use our peripheral vision while driving. It's not just what's straight ahead. What about a kid crossing the road? All right, that you don't see until late because it catches your eye out of the corner of your eye. Your peripheral vision sees someone jumping out in front of the road. Oh, you got to stop, right? Like you need that. But there are almost 15 states that have no visual peripheral vision requirement whatsoever to qualify for a license. To me, that's scary. That's scary. All right. So Louisiana, not only do you not have visual field requirement, but your visual acuity also isn't great. 2070. Better than 2100, but not great. All right, moving on. My number 2 state, South Carolina. South Carolina is not great. They have the worst visual acuity requirement. They just have to have 2120. 2120. So a little bit worse vision than 2100. And that just has to be in their better seeing eye. Awesome. They do have a peripheral vision requirement, a visual field requirement, which is fairly robust. It's about 120 degrees. So I was happy with that. Happy to see that. But the 2100, they get high on my naughty list just because they have the worst visual acuity requirement in America. There's a number of states with 2100. Pennsylvania, you're on there too. You didn't make my list though because you have a robust visual field requirement, but still not great. In the number 1, you might not guess this. All right, might come as a surprise. Wisconsin, that's right. 2100 in their better seeing eye. So only one eye has to see 2100. So we know that's bad. But then also, see the other states that have 2100 on their visual acuity requirement, at least they have a pretty robust peripheral vision requirement. But Wisconsin, only 20 degrees from center in one eye. Only one eye. They can be totally blind in one eye. They can not have an eye. But in their other eye, maybe they have pretty severe glaucoma. They have 2100 vision and they have just a little central island. That person is driving. That person is among you. Wisconsinites. Is that what you call yourself? I don't know. Anyway, so the major point is you should be terrified to drive in this country. No, it's okay. Yeah, kind of. Defensive driving is very important. All right. But it varies widely by state. It's maddening. It's crazy that it's such a huge variation. I wish it was. I think my requirement would be, I think you should have 20/40 vision in at least one eye. Because I have a lot of patients with just one eye that do just fine driving. But you got to have good, if you're only going to have one eye, you got to have good vision. So 20/40 vision in one eye with 120 degrees of peripheral field. All right. If you have that, you can drive without a license. That's fine. Then we can come back on that a little bit if you just want to drive during daytime hours. That's another restriction you can put on someone's license. You can only drive during daytime hours. So anyway, that's the driving laws. So thank you for that. Let's take one more break and then we'll do two more. We have two more questions for you. Okay, here we go. At Lucky Penny 4263 on YouTube said, I enjoy the eye health videos, laughing plus education. It's great. Thank you. Please talk about if there's truth behind Latisse and Orbital fat loss. Good question. That's something I don't know if I've addressed that on Knock Knock Eye before. So Latisse is one of those cosmetic medications that's become very popular because a lot of people out there want long, luscious eyelashes. All right. I have talked about the trend for having these glued on fake lashes that drive me nuts because if you don't go to the right place that does it well, then it can end in disaster where your eyes get puffy and red and you have to have them removed and you get glue in there and it causes this horrible allergic reaction. And it's hard to examine the eyelid whenever you have these big giant snuffleupagus lashes, and it just drives me crazy as an ophthalmologist, but I get it. Get with the times, Glaucom Flecken. That's just the way things are now. I get it, okay? I don't shame people who come in to see me. I just, when they have problems, I tell them why. It's because they're having a reaction to the glue, most likely. And so the other thing, though, to get more of a natural lengthening of your lashes is use this medication called Latisse. So like many things in medicine, the side effects of a medication just happen to be lash lengthening. It's kind of a fortunate thing. So this is a medication. We have a class of medications in glaucoma that are called prostaglandin analogs. And these, what this medication does is it increases outflow of fluid in the eyeball. Because remember, glaucoma, you can think of it, the eye like a bathtub. All right, you're constantly making fluid and you're constantly draining fluid. And there's this steady state balance between the two. And if you make too much fluid, the pressure is going to get high. If you plug the drain, the pressure is going to get high. And so all the different glaucoma medications are geared toward either opening up the drain wider to increase the outflow or decreasing the faucet, turning down the faucet, decreasing the production of fluid in the eye. So prostaglandin analogs like latanoprost, like bimatoprost, those are the two most common. They increase the outflow of the eye and are very effective at lowering the intraocular pressure. So it's a great, in fact, it's usually the first line treatment that we use for glaucoma. Well, a couple of the side effects that people started noticing after using these medications, and they've been around for a long time, is that there's two things. One, people's eyelashes grew. And it's interesting. You see, the younger you are, the more of an effect you get from this. You see kids with congenital glaucoma or juvenile glaucoma who are on these medications, they have the most enormous lashes. And it's incredible how long these lashes can get. They're beautiful lashes. Honestly, they're the types of lashes that people pay a lot of money to have glued onto their face. But these kids, because of this medication and the side effect, And I don't even know if we really know. There's probably some pathophysiologic mechanism for why this happens, but I don't know it. I could look it up probably and try to figure it out, but it doesn't matter. I'm not trying to bore you. We're trying to have fun with the eyes here. It's I don't know the mechanism, but it happens, and the lashes get very long, and it's natural. It's natural lash growth. It's your own lashes that are growing that long. And so, of course, like, big pharma was like, this is something. It's like my spouse or my family member would love this because they're getting their long lashes. They love their long lashes. And so that introduced Latisse. Latisse is this basically cosmetic form of a prostaglandin analog medication, specifically bimatoprost. And so it comes with a little brush. So you just brush it on the lashes. So the idea is that you're not putting it in the eye, all right, which would be more of a pharmacologic like treatment, all right, that you probably can't sell over the counter. Instead, it's a topical treatment just to the eyelashes. I'm pretty sure that's how they get around, being able to give it over the counter versus prescription. And the idea is that it lengthens your lashes. And sure, it does. Yeah, it works. It works. But there are some side effects because that's not the only side effect. Lash lengthening is not the only side effect of this class of medication. So sometimes people can get redness around their eye, like what we call peri-orbital or periocular redness on the skin, the eyelid skin all around the eye. You can get this little reaction, this little redness there. Sometimes redness, and it sometimes is also that could be an allergy, but you also get redness to the eye itself. That can increase your eye redness. People definitely don't like that because then they turn to Visine, which is even more harmful. I'm not going to say Latisse is harmful because that's not true, but so I'm fine. I order it for people when they ask me for it. But the biggest side effect, and what this at Lucky Penny 4263 mentioned, is super roundabout way of explaining this. Sorry, is that it can cause something called orbital fat loss. So, and again, I don't know if we know the mechanism for this, but this class of medication can cause you to lose volume in your orbital fat. So there's a whole bunch of stuff behind your eye in your orbit, and it kind of helps to hold your eye in place. Well, if you start to have atrophy of the tissue back behind the eye, specifically the fat that's behind the eye, well, the eye can start to kind of sink into the orbit, and you can have this kind of prominent, what we call superior sulcus, which is like you see the on me, if you're watching the video, you have the bone over here. Well, so if the eyes start sinking back in your head, then you just look like there's more of a gap. All right, it just looks more the orbital rim, this bony orbit is just more prominent when you look at somebody. People really don't like having that atrophy there. But that's a known side effect of Latisse. So that's the risk you're running if you're using that. Now, it's not going to be overnight. And often, if you stop Latisse, some of that atrophy can resolve. Maybe not all the way, but there is some resolution of this. All right. So if you're noticing that and you're using Latisse, just stop it. It's a cosmetic thing. You don't need this stuff. All right. It's a different case if you have glaucoma and you're using this medication. But anyway, yes, that's a real thing. Orbital fat loss or latanoprost-induced orbitopathy is the fancy term for it. Good question. Thank you. All right. And then I had one more question I wanted to get to here. I love this question. This is good. This is timely. At Call Me Dax 6532 said, question for a future show. How safe or not safe are costume contact lenses you can buy online? With Halloween coming up, people will be wanting to turn their eyes into cat eyes or black out their eyes entirely or any number of other things. I remember hearing in the early 2000s that they weren't very safe, but is that still true? Or is it reasonably safe if you get the right base curve and follow good contact lens wearing practices? Thanks. Love your content. Good question. Oh, thank you so much for bringing this up. Yep. Halloween's right around the corner, and this I do probably once a year around Halloween, see someone come in with bad corneal abrasions from these cosmetic contact lenses that just don't fit. The way contact lens wear is supposed to work is you see typically an optometrist. Ophthalmologists don't do a lot with contact lenses, really at all. Maybe they did once upon a time, but in this day and age, it's really optometry, an optometrist's world with regard to contact lenses. And so typically, we'll set up a patient with an appointment with one of the optometrists that works with us in our practice, and they do a contact lens fitting. So they take measurements of your eye. They determine what this person mentioned, which is a base curve. It's just the curvature of and check your prescription, check what you need. Put the contact lens on your eye and make sure it sits correctly. Make sure it's not too tight or it's not too loose, and it's going to fold up in your eye and cause problems there. But if it's too tight, then it'll rub up against the cornea, and that can cause abrasions. That can result in infection. So it's not as easy as, oh, you're a -2. Here's a contact. Wear it. No, it's got to fit. Every eye is a different shape. And these lenses, they come in different base curves. They come in a different curvature, some brands work better for some people versus others. Some people don't do well in monthlies and they go to dailies. And some people like more of a robust contact lens. Some people love rigid lenses still. There's a whole ecosystem of contact lenses out there. It'll make your head spin. So, knowing that that's how it works in like board certified ophthalmology land, now we're talking about getting cosmetic lenses that make your eye look like a cat off of Spirit Halloween's website. You can see how that would be a bad idea, right? So here's what I would recommend. If you are dead set on wearing cosmetic lenses that you just buy online, the best advice I can give you, honestly, is pony up the money to make an appointment with an eye doctor to get an exam, and I would bring those lenses in with you and have them looked at by an eye doctor. And they can look and see, okay, no, this is terrible, or yeah, this seems reasonable, or maybe even, depending on the type of lens this is, they can look at it on your eye and tell you if it's safe to wear. Regardless, if you get one of these types of cosmetic lenses off the internet, wear it for the shortest amount of time you possibly can. We're talking, if you're going to a party, 2 hours max. Take it out immediately. As short a time as possible to limit your risk of having problems. And if you're in pain with them in, take them out immediately, okay? But honestly, I would have someone that knows a thing or two about contacts, have them look at it, especially if it's just some random thing you found off the internet, all right? In fact, I'm just going to say, don't wear random things you find on the internet, all right? I don't know if there's reputable places that sell these types of contacts. That would be a good question for an optometrist. I do not have that information for you, okay? Just be very, very careful. It's your eye. It's a mucous membrane. It's an organ. Your eye is an organ, folks. Some would say, I don't know who, that it's the most important organ in your body. I don't know. But it's something you don't take lightly, all right? So please be careful out there and have a happy Halloween. We're still like weeks away, but Anyway, I'm glad that came up because I've got to leave right now to go take my kid to a Spirit Halloween store. She's been hounding me ever since. I don't know. My kids really, they get into the Halloween spirit, which I love. It's a wonderful holiday. I really do like it because there's eyeballs everywhere. I love the spooky eyeballs, folks. I've decorated my house all with eyeballs, which I plan on doing again. I have more inflatable eyeballs in this house for Halloween purposes than I care to admit. I'll leave it at that. All right, maybe I'll take pictures this year. All right, thank you all for listening. That's our episode for today. I'm your host, Will Flannery, also known as Dr. Glaucomflecken. Thanks to my executive producers, Aaron Corney, Rob Goldman, and Shanti Brick. Editor and engineers, Jason Portizo. Our music is by Omer Benzvi. Give me all your thoughts, your questions, your concerns, your corrections, all the C things. All right, give me your thoughts. The best way to do it, post a comment on our YouTube channel at Glaucomfleckens. All right, we'll see you next time. Knock Knock I is a human content production.
Knock knock, goodbye.
Thanks for watching the episode. You can find more on that playlist over there. If you prefer to listen, or you just had your eyes dilated, you can binge full episodes wherever you get your podcasts. Or join the party over on Patreon, where you get early access episodes, hang out with us, get lots of exclusive bonus content. Hope you subscribe, leave a comment below. Let us know what you think.